All right, I'm Dr. Rayapudi from Gastro Office. I get uh, at least decent number of patients who have a problem with leakage of stool. It's called fecal incontinence, and it's a common condition, but not reported to the doctors in general because of the social stigma associated with it. And as far as causes of the fecal incontinence, sometimes you could have neurological injuries to the spinal cord, or conditions like multiple sclerosis that can cause leakage of stool. And at times, the rectum, which is the last part of the last part just above the anus, it cannot distend very well. It could be because of scarring that happens in that area from Crohn's disease or ulcerative colitis. Then you cannot control the stool. That's another reason. And very common in middle-aged or older females is because of anal trauma that develops because of the difficult vaginal delivery or a prolonged vaginal delivery, and that can cause damage when, let's say, you're a middle-aged female, you have the delivery, and then you're compensating at that point. But as you get older, the muscles tend to get weaker in the pelvic floor, and then it tends to manifest either in terms of fecal incontinence, like stool leakage of stool, or urinary incontinence, leakage of urine, because both the sphincters in the female are kind of controlled through the same muscles. So having a stool that is stuck in the rectum is called fecal impaction. If that happens, then liquid stool can seep around it and the anal sphincter is not able to close, then you can develop fecal incontinence. And I have had at least few patients with long-standing burnt-out diabetes, because diabetes is a disease that affects various systems, including nerves that supply the sphincters in the bottom, and you tend to develop leakage of stools from that condition. I even had one patient who had burnt out diabetes who had it for almost 30 plus years, and they call him brittle diabetes at this point. And he was not able to leave his house just because of his problem with leaking out stool wherever he goes. So it's a big problem with poorly controlled diabetes over a long period of time. And if someone has a diarrhea, let's assume you have severe diarrhea from bad illness, like viral gastroenteritis, you could develop severe diarrhea, and that itself can cause you to leak stool, but that doesn't mean you have a serious problem. Because once your diarrhea is corrected, then you go back to normal. Or sometimes people have Crohn's disease, ulcerative colitis, where they're passing a lot of stools, and that causes leakage of stools, and that doesn't essentially mean you have permanent fecal incontinence, but it could be a temporary issue and it can resolve over time. So as far as treatments for this condition, usually I tell all my patients to start with fiber, which is like either Benifiber or Metamucil, 2 tablespoons daily at night time. And that tends to bulk up your stool and you tend to pass less number of stools. And if it is caused by an underlying condition like a viral gastroenteritis or inflammatory bowel disease, obviously those need to be looked into as to how to correct the problem in that area. And a lot of times patients already pick up Imodium over the counter. Imodium is a medication you can get over the counter. Usually take a small dose like 3 or 4 times a day, or as needed. I tell patients to take it right before like a long car drive, or if they're going somewhere like a show or a movie, they can take 1 or 2 pills before they get there so they don't have to run for a bathroom for the next 2 to 3 hours. And there are some other ways in which they were trying to control it. Sometimes previously there was a bulking agent that they used to inject in the anal canal that used to bulk up the area in that location so that you get good apposition of the anal muscles and prevent them from leaking out stool. But it has fallen out of favor recently due to some insurance coverage issues, etc. But it's still available, except that in the US, I think there's one company that was making it, which probably is not doing it anymore. We'll have to get the latest data on it. But the other options are sometimes they use something called anal plugs, and those can be used in conjunction with other sorts of treatments to prevent people from leaking out. Then there is the option of sacral neuromodulation, where you're trying to stimulate the muscles in that area by directly stimulating the nerves that supply those muscles. The sacral neuromodulation is an effective technique for people who are unable to control leakage of stools using the other methods. In addition to this, behaviorally, if there's a problem with holding of stool or fecal impaction, there's a defecation program sometimes patients can get into, where people are with mental conditions, etc., are trained into certain passing stool at a certain time, making them develop good defecation habits, which will prevent the stool from accumulating in the rectum and thereby leakage of stool. That is one good thing to learn about. And there is biofeedback therapy, where you retrain the muscles in the bottom, develop some strength in the pelvic floor, which will help retain it, retain all the contents at will. And the last case options are a colostomy. In people who cannot opt for surgery, they can make an opening in the colon and then let it collect out through a bag, so they're not leaking out all the time. That's like one of the last options. And there's always surgical options for people who develop like severe trauma after vaginal delivery, or develop a big tear in that muscle in the bottom. Then they can always be corrected through surgical means, and that sphincter repairs, anal sphincter tears, etc., can be corrected through surgery. But overall, it's a vexing problem in a lot of the female, in the mostly the elderly female population that we see at our office, and it's very underreported. And there are good options nowadays, so you should always think about it when you visit your GI doctor and bring it up, so he can present you some of these options and see which one you could try.